Hello, we are Team 5, and we would like to introduce to you Crypto MedRec, or CMR. How can health professionals take better care of you today? One way that we have noticed in the market is sufficient medical records. Being able to provide digitalized medical records can be able to ensure better health results for all patients. By Johns Hopkins research in 2016, they have found that more than 250,000 deaths are due to incorrect medical records. By having blockchain and crypto, we are able to mitigate these deaths in the future by being able to have sufficient data for doctors or any health professionals to take care of patients. Our project is going to tackle the organization of medical records and the availability of having those records on file for healthcare professionals in a quick fashion. In the market today, doctors are experiencing lack of transparency between patient information and medical records. Due to this, doctors are not entirely aware of medical issues the patient has dealt with in the past to be able to assist them today. Our digitalized medical records, CMR, is here to help in these instances and more going forward. CMR is here to assist with individuals' medical history in being able to encrypt ways through blockchain platforms utilizing IoT devices to easily access that data. Our product is an invisible ink QR code that is able to be scanned. And with that, it's going to be providing lifelong medical records to ensure doctors have enough data to insure them, or even to service them. Going through that blockchain, like I said before, IoT devices that we're going to utilize are going to scan the CMR codes that are going to be visible through blue lights at the facilities, and it's going to be behind the ear of anyone who's from a young age all the way up to an older age who may or may not be coherent at the time or have not had access to their medical records in a long time, but being able to communicate those things to the doctor. The doctor can scan the QR code and access the medical records through a database. So once they scan that, the database will come onto their computers or to any of their devices, and the doctor is now instantly having access to the patient's entire medical history. For example, the patient's past operations, allergies, current medications, and from this point, the doctor can now quickly diagnose the patient and being able to move forward in a more sufficient way. So as you can see from this image, is that you're now seeing what is about the patient and how they're able to interact with that through blockchain. So the doctor is able to have those prescriptions, being able to review their records. Also, so is the patient being able to deny those records, as well as the doctor deny them between which level of doctor it is. Because there's major differences between the OBGYN all the way to a surgeon. So what things will be shown to them in a cryptid way. Then you can also see from this image that the optimizing the blockchain can also be in terms of crypto, being sold information to those medical scientists, the doctors, and some also pharmacists as well, to be able to use the EMR codes or EMR data to be able to have those prescriptions. Now our partners. All of us are in this together. Our partners are the ones who are going to help us move things forward. And those are medical record companies today, attorneys in cybersecurity agencies, medical engineers, and also those financial owners. They're the ones that are going to be our key partners to be able to leverage moving not only blockchain forward, crypto, but also the ins and outs of what we need from a medical standpoint to be able to speak to those doctors quickly. Key resources. We need that blockchain and that QR code to be able to have that data. Also, we would not be anything if it wasn't for the patients or the customers and the doctors. So being able to have those medical records and being able to know Have they been allergic to in the past? What have they been allergic to or been able to take in the past? Also, what are some of their interactions just from a medical standpoint? Here it is an example of, and here is our business model canvas going through our key partners, our key activities, our value propositions, our customer relationships, our customer segments, our key resources, our channels, and then also how we're going to be costing it our revenues. It's really important here of our key resources in order to be able to get that data, then also our key activities and how we're going to be able to use that invisible QR code and being able to develop and maintain that platform. In addition, what are those channels? We're going to be using hospitals, outpatient facilities, different institutions for medical engineers as well as medical students, using some of those councils and associations, using IT and software platforms, and also those who make those chips. But really and truly what's important are those customer relationships and those customer segments to be really going down into our value proposition, which is for the customers. It's really important to be able to know how to best take care of them, to not have that number of 250,000 plus deaths in a year that we're noticing from medical records or not being able to service patients quickly. And we're Team 5. Thank you.